The answers to many of healthcare's clinical and business questions are locked within each individual patient journey. Yet the process to understand these journeys has been limited by disparate data sets, disconnected point solutions, and manual analyses. Extracting actionable insights requires a 360-degree view of patient journeys that can only be achieved with big data and machine learning. Thankfully, it is now possible to break free from the inefficiencies of legacy analytics and harness the power of our collective health data to instantly answer healthcare's most complex questions. Meet the Clarify Atlas platform, healthcare's most precise and actionable source of insights. It securely links data from over 300 million individual patient lives, including 15 billion government and commercial medical and RX claim records, clinical data, and 400-plus social determinant of health factors, making our platform the largest collection of longitudinal patient journeys. Atlas delivers more than 18 billion AI-powered predictions that can be explored via self-service analytics software applications. Simply put, Atlas transforms healthcare data that was previously inaccessible and unusable into actionable insights.
Hear in their own words why they should win.
The way healthcare is paid for today rewards people to do more activity.
And that's just not the way that healthcare should work. And so we are out to fundamentally change the way in which clinicians are rewarded for the work that they ultimately want to do.
The thing that Clarify does uniquely well is to assess how care is delivered and how well it is delivered in a much more precise way than has ever been possible before.
We're now playing that role of being the system that calculates and figures out who should be rewarded for what work.
Because Clarify's platforms are helping to make it easier to pay for value-based arrangements, it is accelerating the adoption of value-based care, particularly in commercial markets. In fact, we often say we're not in the business of selling analytics, we're in the business of helping our partners to do things such as pick the best doctors for a given individual, make the right referrals, find more diverse patients for clinical trials.
There has been no technology provider that has delivered this comprehensive enterprise analytics stack and enterprise analytics platform in the healthcare industry.
TaylorMed is a healthcare technology company driven by a mission to remove patient financial barriers to care. We support providers by proactively identifying and addressing financial risk for patients, creating a streamlined financial assistance workflow for teams, and increasing revenue collections. Our solution is used by community-based practices, infusion centers, and health systems across the country.
Hear in their own words why they should win.
Hi, I'm Sulik Dvorsky, co-founder and CEO of TaylorMed. We are a leading healthcare technology company dedicated to removing financial barriers to care. Healthcare has become increasingly unaffordable. 100 million Americans live with medical debt, and nearly 1 in 5 people reported that someone in their household skipped care in the past year due to cost. The consequences are far-reaching. Patients are less likely to adhere to treatment, and for providers and pharmacies, this leads to worse patient outcomes and poor financial performance. This urgent problem requires a comprehensive solution, and that's why we're building the largest network of patients, providers, pharmacies, life sciences companies, and other partners, all dedicated to tackling affordability anywhere a prescription is written or dispensed. The network is powered by our best-in-class financial navigation platform, which enables healthcare organizations to proactively identify patients in need. It then automates the process of matching patients and enrolling them into cost-saving resources from copay cards, free drug programs, and charitable organizations. Our network-driven, technology-powered approach has enabled us to secure over $1.5 billion in savings from over 5,000 programs covering more than 1,000 chronic conditions. Last year, we doubled the size of our network with the acquisition of the financial assistance platform Vibor, enabling us to touch more patients than before. As we continue to evolve and expand, we're engaging directly with patients who want to take an active role in their own financial experience. Our newest solution empowers consumers to secure financial assistance for their medication through a user-friendly experience. The support of the UCSF Health Award will help us make our vision a reality, because no one should have to choose between necessary living expenses and life-saving care.
Wildflower offers a high-performance hub for value-based OB care. We make it easy for expecting moms to stay connected to their care teams and health plans. We also create a seamless transition from fee-for-service to value-based care. We deploy our solution with the provider and payers. Wildflower measures and reports on outcomes to demonstrate the positive impact this has on cost, quality, and patient and clinician satisfaction. Our model results in healthy moms and babies, positive long-term relationships with families, and high-quality care that is appropriately rewarded. Empowering women, collapsing silos, rewarding value. This is a smarter way to care.
Hear in their own words why they should win.
And what makes our company really unique is that we are the first and only company delivering a value-based care solution focused on women's care. For context, we've been operating in this space for about 10 years. We have delivered over the years a digital platform to health plans and to providers that has had a demonstrable impact on cost and quality. In the past 2 years, in recognition of the fact that for us to really scale our impact as a company, we have to support not only the technology and care models, but also the economic models. We have dramatically extended our solution to not only provide software, but to provide a set of services that help our industry, the OBs and the facilities we work with, to move from fee-for-service into paying for value so that we can really, again, scale the cost and quality savings available. In order to do that, we have removed the barriers of adoption of value-based care. Those barriers include having an episode model and payment models that are easy to administer and comprehensive enough to reward care transformation, having the tools and services necessary for providers to undertake care transformation, and having things available that fill in the gaps for services that need to be done in order to hit value-based savings target, but may not be reimbursed under the current fee-for-service model. Wildflower helps address all of that with a solution set that includes digital, which wraps around OB practices to help them transform their patient workflow, a set of care coordination services and virtual care networks that can help them meet the needs of both high-risk and routine pregnancies, and last but not least, an OB and newborn episode model that is proprietary and turnkey to help providers and payers easily put in these payment models with all of the claims analytics and predictive modeling need to really meet the needs of value-based care.
If you or a loved one is a survivor of a stroke, brain injury, or living with dementia, Constant Therapy is a clinically proven mobile app that can help practice language and thinking skills anytime, anywhere. Your plan can be set up by your clinician or on your own. Here's how it works. Constant Therapy starts by focusing on your goals, like improving your reading skills or ability to manage your day. To get started, we'll do a brief assessment of your abilities and build a personalized plan that's right for you. Some exercises help with speaking, some help with memory. Other exercises, more than 80 different types to choose from, can help based on your goals. Then, to ensure you stay challenged, Constant Therapy will automatically adjust and progress as you do. You'll get immediate feedback about how you're doing and what still needs some work. Once set up, most people can use Constant Therapy on their own. But you're never alone. You'll always get encouragement along the way.
All done for today. Keep it up.
And you can call our friendly support team for additional help. The brain's ability to heal never stops, so therapy shouldn't either. It's time for Constant Therapy. Brain health for life.
Hear in their own words why they should win.
Hi, I'm Veera Anantha, founder and CEO of Constant Therapy Health. We provide digital, cognitive, and speech therapy to patients with neurological disorders and cognitive impairments. Millions of people after an event such as a stroke, brain injury, or diagnosis of dementia have chronic cognitive disorders. We enable these patients to be able to get therapy on their smart devices that they can access anytime and anywhere, especially at home, leading to standard of care with much more access to therapy at significantly lower cost. Patients get a guided AI-driven experience where they get personalized exercises tuned for their specific needs and access that anytime they need it. Clinicians can monitor this progress and also provide systematic care to these patients when they are able to see these patients in the clinic, leading to significant cost savings for the health system. Today, we are the leader in providing digital speech and cognitive therapy. We have delivered over 200 million exercises to these patients, which our AI engine, the neural performance engine that's patented, can use to truly deliver personalized therapy exercises to these types of patients. We have a growing body of clinical evidence across different therapeutic areas, including stroke and dementia, and we have the FDA breakthrough designation for stroke. Constant therapy is really able to take what used to be standard of care, which was very sporadic, maybe once a week, to what you see on the right here, which is much more systematic access to therapy, especially for patients at home, so that it can truly improve outcomes. Today, the program has enabled over 500,000 patients in their therapy journey, and it's used across the country by institutions such as the VA, and we are on the path to becoming the standard of care for at-home speech and cognitive therapy. Thank you.
Maya is here to assist you throughout your knee replacement journey. She can help answer your questions, and she can also connect you with the clinic if you have any concerns.
Okay, that sounds great.
Good morning, Cindy. Your knee replacement surgery is 3 days away. Remember that your doctor recommended not to take aspirin for within a week of your surgery.
I remember. My leg is feeling sore though. What else can I take?
I'm sorry to hear that you're experiencing leg soreness. Most patients can use Tylenol to help manage pain before surgery, but you should check in with the surgeon first. Would you like me to schedule a telehealth appointment?
No, not right now.
Are you experiencing any other new symptoms?
I also have a bit of a headache, but I'm not too worried.
Okay, I'll let the care team know. It's time for your daily check-in. How much pain are you feeling on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain imaginable?
I think I'm around a 3.
It's important to look out for symptoms of infection, such as redness, swelling, drainage from the wound, and fever. Are you experiencing any of these symptoms?
No.
Do you have any other questions or concerns?
How active can I be after this surgery?
The exercises that you learned at the hospital should be continued at home. These exercises, along with low-impact activities like walking, will help strengthen your knee muscles. Would you like me to schedule a telehealth appointment with your physical therapist to go over your exercise routine?
Hear in their own words why they should win.
Welcome to Maya MD. My name is Mark Kozak. I'm one of the co-founders and chief operating officer. Maya's transformative healthcare platform is intelligent, predictive, and engaging. The 3 key challenges that we address are 1, the rising cost of care, 2, the shrinking physician workforce, and 3, the lack of patient engagement, which is the $200 billion problem here in the US. In order to have the highest quality of care and better outcomes, we need technology tools to fill in the gap. Then technology is also only effective if you have good patient engagement. In order to improve patient engagement, there are 3 key capabilities a platform must have. They are clinical intelligence. Without clinical intelligence, the interaction is meaningless. The engagement with the patient also has to be personalized. 2, it has to seamlessly integrate into the patient's daily routine. Having Maya engage with the patient during an advertisement is a natural place to provide a health reminder. With our targeted demographic, 95% of Medicare-age patients watch 3 to 4 hours of TV per day. And number 3, we need prediction tools. Nationally, 20% of patients contribute to 80% of the cost. We need to proactively engage those 20% to keep them from declining.
It's time for your daily check-in. How much pain are you feeling on a scale of 0 to 10, where 0 is no pain and 10 is the worst pain imaginable?
I think I'm around a 3.
It's important to look out for symptoms of infection, such as redness, swelling, drainage from the wound, and fever. Are you experiencing any of these symptoms?
No.
So what is unique about Maya is her robust clinical intelligence and processing speed. Her brain was built over an 8-year period and can diagnose and manage over 8,600 conditions and recommend the next best step for those chronic diseases. She can also triage a patient in less than 1 minute. Maya's clinical robustness and accuracy are well published and validated through research projects and testing by top universities, even going so far in a peer-reviewed study with UCLA and the University of Michigan that demonstrated that Maya outperformed emergency room physicians in accurately triaging a patient to the most appropriate and cost-effective provider setting.
When you don't have a stable home, you're 30 times more likely to land in the emergency room or hospital. This simple fact drives $200 billion in annual avoidable costs to our health systems from populations facing homelessness, addiction, and mental illness. Amazing companies like Amp Eartha and Unite Us have risen up to better coordinate healthcare and social services. But no one has figured out how to engage the individual, each with their own diverse set of needs, in that process at scale. That's where Samaritan comes in. First, we'll team up with frontline care partners to give out Samaritan memberships to target populations. Samaritan members get one of our Bluetooth smart wallets here from the local care partner, sharing top-level goals and then breaking them down into composite needs and action steps. From there, members access financial and social support directly to meet strategic needs and earn bonuses by taking action steps towards goals, such as meeting with a housing specialist or accessing primary care or submitting a job application. More than 50% of our platform's members measurably improve their access to care, income, housing, or another area of life within 12 months. Now, these outcomes are associated with 10 to 50% reductions in cost of care. That can be more than $25,000 in customer savings per person per year.
Hear in their own words why they should win.
Augmented and virtual reality experiences were only dreamed of just a generation ago, like something out of a sci-fi movie that we'd probably never see come to life. Today, it's surprisingly becoming a mainstream form of entertainment. The experiences feel so real that users can get totally immersed in a world that's far different from reality. While some people are utilizing this innovation purely for fun, Veena Somareddy saw a more serious application for this revolutionary technology.
More than 800,000 people just in the United States suffer from a stroke. Each year, 1.3 million are diagnosed with traumatic brain injuries, about 60,000 are diagnosed with spinal cord injuries, and so many thousands and thousands of people are diagnosed with neurodegenerative disease like Parkinson's, Alzheimer's, and all of that mostly leading to long-term disability. My background has always been in creating virtual reality applications for the medical field and for simulation and training. And when my co-founder Bruce Conti approached me about integrating VR into his clinics, I thought this was really amazing opportunity for the patients and for the therapists too, to create something that's more fun, exciting and motivating for the patients and a really good tool for the therapists to use.
The high cost of physical therapy, coupled with the fact that insurance only covers a certain number of therapy sessions, makes the idea of using virtual reality for therapy very intriguing. Through various immersive 3D environments, the patient can work on their cognitive as well as physical therapy at the same time, instead of doing each in isolation.
At Coda Health, we've digitized the clinically and legally complex process of proactive healthcare planning, making it simple and accessible at scale through a patient's own doctor. Introduced by the healthcare provider, the Coda platform does the conversational heavy lifting, allowing physicians to standardize the discussion and streamline the billing process. Our proprietary technology first identifies a patient's core values and what quality of life means to them, so that videos and content can be tailored to create a truly engaging experience. Patients then receive personalized content on topics such as life support and learn about selecting a medical decision maker. And if they're ready, they can indicate their preferences. Providers have real-time access to review patient care plans and can easily access data to better understand their patient population.
Hear in their own words why they should win.
Physician discomfort with end-of-life care conversations. It's created an epidemic of misdirected and often unwanted care that costs health systems and payers over $100 billion each year in avoidable care costs. And despite regulatory pressures from Medicare, cost savings of nearly $10,000 per patient, and new shared savings programs that are pushing this conversation into the value-based care space, patient and physician adoption of advanced care planning remains in the single digits. Why? My name is Tatiana. I'm the CEO of Coda Health, and we think it boils down to a lack of time, training, and tools. So Coda Health is a patient-driven platform for shared decision-making and decision capture that navigates these conversations at scale. So basically, it's like TurboTax, but for difficult conversations in healthcare. Our proprietary algorithms drive patient decision-making, and we capture those decisions through the creation of legal documents like advance directives and medical powers of attorney, which integrate with the health system's electronic medical record so that patients can update and notarize those care preferences at any time, and our customers always have the most up-to-date information. Now, being a single source of truth for patients, providers, and systems is novel, but our true superpower is intentional patient-driven design. Our users are 65 to 95 years old. Our average age is 78, and yet 58% of Coda patients create a care plan. That's 5 times higher than the national average. Our user experience is unmatched, and it drives equity of access to boot, with advanced care planning completion rates in our Black patients actually exceeding those of our white patients. Now, we think we're rising stars because this has resonated deeply, and we're barely out of the gates and already working with some of the biggest names in the space, helping them deliver care patients actually want at scale for less.
With the advent of price transparency regulations, Turquoise Health has been on a mission to simplify healthcare. Turquoise has compiled and standardized more than 1 billion records from payers and providers into our Clear Rates data platform. This platform contains publicly available pricing information representing more than 550 health systems and 100 insurance carriers. Turquoise's goal is to become the source of truth for healthcare pricing information, and the Clear Rates data platform is our foundation to do just that. For example, patients can use the Turquoise website and search for a procedure in their zip code and get a range of cash prices. On the other side of the equation, any payers, providers, ASCs, or other stakeholders can use our platform to understand pricing in their area or other geography. Using the Clear Contracts tool, any two parties can negotiate and finalize contracts with benchmarking information at their fingertips. With Turquoise, all stakeholders can easily leverage pricing data and promote patient cost savings no matter their role in healthcare.
Hello, I'm Dr. Michael Havig, founder and CEO of Help Me Technology. I want to thank you for taking the time to learn a bit more about our direct-to-consumer healthcare solution. So we all can agree that healthcare accounts for a very large segment of our economy, yet most don't realize that out-of-pocket payments were over $400 billion in 2019 and growing. And when patients have to spend their own money on their healthcare, they want to shop. But they can't because healthcare lags behind other industries in the digital consumer experience. And why is that? Well, quite honestly, it's because doctors and patients aren't connected and neither really know the cost of their care. As a practicing physician, I have no idea what the services I provide on a daily basis are going to cost patients, and they often don't know for 30, 60, 90, 120 days what they owe me. And you know what? I think we can do a lot better. So at HealthMe, we teach doctors to retail by giving them a Shopify-like experience, which combines the best features and benefits of a consumer-friendly digital marketplace with the efficiency and security of a specialized healthcare payment processing solution. So patients can find their care, pay in advance, the money's held in escrow, and we pay the doctor at the time of service, not 30, 60, 90 days later. This increases efficiency and lowers costs, giving patients access to the care they need. We generate revenue by charging a technology fee on all transactions through the platform. We also charge a monthly fee to the physicians and a one-time onboarding fee, as well as financing options and marketing partnerships to generate additional revenue. We're growing rapidly to 2,500 providers by the year end, and our revenues have grown at 29% month over month. We put together a great team to scale this platform, and the big picture really is we're growing a market network of digitally connected, transparently priced healthcare providers, which we can deploy to self-funded employers, digital-first companies, sharing ministries, and others.
This is Amy. Amy is on a daily medication, but life is busy and expensive. So sometimes the thought of refilling her prescription can be overwhelming, and it just slips through the cracks. But Amy is lucky. This year, her health plan partnered with Sempre Health to help her save on money and keep her health on track. This means Amy will receive texts like, if you pick up your prescription on time, your copay will be just $10. Otherwise, this will go back up to $30. By making the right choices for her health, Amy can save hundreds per year. And when Amy is healthier, her health plan wins too. Here's how it works. Sempre Health contacts Amy on behalf of her health plan to enroll. She receives a discount code sent straight to her phone via text message. The next time Amy is at the pharmacy, she shows the pharmacist her discount code and saves on her copay immediately. From then on, when it's time to fill her prescription, Amy gets a text reminder and her discounts are automatically applied. Amy will never pay more than her original insurance copay.
Señor Luis, ¿cómo fue con la sin sedante? Hicimos la operación sin ningún sedante, solamente la realidad virtual. ¿Cómo se sintió?
Yo me sentí muy bien. Me gusta ese procedimiento porque no me duermo y a mí no me gusta dormirme y es muy agradable.
Exacto. Y te habíamos operado la mano izquierda hace ¿cuánto tiempo?
Hace un año.
Hace un año y como compara los dos. En ese tiempo estabas básicamente como dormido. Sí. Y ahora y la mano derecha, manténgalo al alto. Sí. ¿Qué diferencia?
Bueno, al terminar la operación, esta que quedó bien, pero me quedé dormido mucho tiempo y sentía cierto malestar quizás por él. Y con esta no, ya cuando salí del salón me sentía perfectamente bien.
Como si nada. Y puedes comer inmediatamente, no hay problema de náusea, perfecto.
De nada, muy bien.
¿Y qué estabas viendo? ¿Una playa o cuál era?
La profundidad es marina.
Ah, la de marina, divino ambiente. Bueno, gracias.
Hear in their own words why they should win.
At Waiver, we have embraced a technology that puts the patients fully immersed into an environment where they are completely distracted. 90% of my last 800 patients undergoing office-based procedures, such as carpal tunnel releases, elected to use VR, and 80% of those who used it reported that the experience of having awake surgery was fun. It also reduced their anxiety and the pain of injection for patients who reported needle phobia. The Waiver patients had none of the inconveniences of sedation or general anesthesia. Surgery had become a simple office visit. They needed no preoperative testing. They took most of their usual medications. There was never a need for a cardiology or pulmonary clearance from another doctor's office, and they didn't have to miss breakfast or arrive hours early to be rendered unconscious for surgery. They could drive home from their procedures, and they didn't need an accompanying adult. We have found that VR has not only facilitated low-risk surgery, but it also avoids the staggering time and cost and production needed to facilitate full anesthesia. I was able to do 2 to 3 times as many surgeries in the same time period. The impact of these costs are felt from the patient to the payer to the provider. At Wide Awake VR, we believe that it is time to reevaluate the necessity of central nervous anesthesia in minor procedures. We embrace the advent of a new technology that makes the patient's experience safer and far more enjoyable. And we also believe that waiver will impact any uncomfortable or anxiety-provoking medical procedure in a multitude of clinical environments. It is time to take the patients from just put me out, doc, to please put me somewhere else. There are simply too many benefits for too many stakeholders. We hope that you will join us by investing in the future of medical procedures where the patient and their surgeon are prioritized and empowered. You're about to experience a new paradigm in surgical delivery, free from the constraints of the 20th century. Welcome to Waiver.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.